Dear colleague, I present to you a case of situs inversus. Situs inversus is an extremely rare malformation characterized by the fact that the thoracic and abdominal organs are arranged in a mirror image fashion along the midline. What does this mean? For example, it means that the heart and stomach, which are normally located on the left, will be regularly positioned on the right side, and the same goes for the liver and gallbladder, which instead of being on the right side will be located on the left. The same applies to the lungs, let's say, with a mirrored alteration between the two sides, where the bilobed and trilobed lungs are switched. In reality, it is in fact actually an anomaly that in many cases does not present with any other associated signs or symptoms, meaning there are no heart defects, no gastrointestinal tract anomalies, and therefore it can easily go unnoticed, because a proper and thorough assessment of the situs is not always performed when we carry out the ultrasound examination. In this particular instance, the exam was done at 18 weeks for a routine checkup. In fact, someone might reasonably argue that this type of pathology could potentially be diagnosed even earlier, for example, during the first trimester screening, where actually the only thing that is required is the correct concordance between the position of the heart and the stomach. However, an assessment of the situs is not required at that particular stage. This evaluation is instead considered to be part of the screenings in the second trimester, so between 19 and 21 weeks. The images you see scrolling across the screen are of a completely normal, healthy fetus. And you will notice, for example, that in this particular case, we have a fetus in breech position, with the back positioned to the right side of the patient's body. Therefore, what should be the right side is positioned under normal conditions. That is, when the usual arrangement is followed and nothing is out of the ordinary at the top, and everything that should be on the left should be positioned at the bottom, just as it is typically expected to be. But instead, we have the exact opposite. So, at the top, which is the right side, we have the 4 chambers that you see in this image, and you will also see the stomach. On the left, instead, we have the liver and gallbladder. The position of the aorta in front of the spine is, of course, normal, naturally, but the vena cava is not positioned anterior right. Instead, in this case, it is positioned anterior and left. You will always see this in the images. Of course, the same thing also happens with the kidneys, which are in fact 2 organs quite similar to each other, so it's difficult to notice any particular difference. But it's especially important to check in particular that there are no associated anomalies. Actually, the most important thing to check, though in this case everything is normal, is that there isn't an ambiguous situs, meaning a discordance between the arrangement of the organs in the chest and abdomen. So we need to make sure there aren't conditions called heterotaxy or isomerism, which obviously have a worse prognosis because in most cases they are associated with significant heart defects, most often complex congenital heart diseases. Here you can see, as we have already discussed, that the top is the right side and the bottom is the left side, and we are going to perform, even though we are at a very early stage, a thorough and careful study of the heart, because there also needs to be correspondence and concordance in the cardiac anatomy. That is, let's say, beneath the stomach, there should be the ventricle that is morphologically left, and on the other side, the ventricle that is morphologically right. And there must obviously be concordance in, let's say, the atrial aspect as well. So on the left, in the left atrium, which in this case will be the atrium located on the right, we will have the entry of the pulmonary veins, and vice versa. On the other side, we will have let's say, an atrium that is morphologically right, but is obviously located on the left, because this alteration is, as mentioned, a mirror image type alteration, which, as you can imagine, is a rare and interesting anatomical variation. There are numerous genes involved in this type of pathology. In this particular case, the patient had undergone a normal screening test, a normal second test, and a regular fetal DNA test. But fundamentally, there are more than 100 genes involved. And why is it important to make this kind of diagnosis? If we have said that generally there are no associated anomalies in these conditions, Well, because in some conditions other pathologies can be associated, such as Cartagener syndrome, which is a ciliary dyskinesia. A ciliary dyskinesia that obviously has a prognosis, let's say, not necessarily affecting life expectancy, but certainly affecting quality of life, because there is an alteration of pulmonary secretions and intestinal secretions. In women, there is often an alteration in fertility, and therefore it should be thoroughly investigated from a comprehensive genetic standpoint. This is, of course, typically done by using an array or a microarray or whatever specific method the geneticist deems most appropriate to perform in order to accurately identify such underlying conditions. Let us remember that before the advent of prenatal ultrasound, this type of diagnosis was made at an advanced stage and entirely by chance, when radiological or ultrasound examinations were performed for other reasons. Today, with the use of ultrasound, especially in the prenatal period, this type of diagnosis is made quite easily, provided, of course, as I mentioned, that we always remember to check the situs at the beginning of every examination. In the meantime, you are seeing images of the heart. Obviously, as I mentioned, we are at a slightly earlier stage, but it is important to observe, as I said, the regular atrioventricular and ventriculo-arterial concordance, and as mentioned, to assess that there are no associated anomalies. Here you can still see the heart and check, for example, that both kidneys are present, that they are normal, and that there are no associated anomalies. The prognosis is obviously good, provided that the genetic profile is normal, and of course, that there are no anomalies of the cardiovascular system or in general of the thoracic and abdominal structures. In this case, the prognosis is therefore not related to the mirror image arrangement, but rather to any individual abnormalities present in the specific case. Here you can see a perfect aorta emerging from the ventricle, which appears morphologically left-sided, but, as mentioned, is located on the right side of the patient.
What is situs inversus? It is a rare condition characterized by an abnormal arrangement of the organs compared to what normally occurs, or more precisely by a mirror image arrangement of the organs relative to the norm. What does that mean? That in situs solitus, the organs located on the right are in the abdomen, the liver, and the vena cava, and in the chest, the trilobed lung, and the morphologically right atrium. On the left side, we will find the stomach and the spleen in the abdomen together with the abdominal aorta, while in the thorax, we have the bilobed lung and the other morphologically left. In situs inversus, however, this arrangement becomes mirrored. So what does that mean? It means that what is on the left is placed on the right and what is on the right is placed on the left. So it's a diagnosis that very often is, let's say, not made correctly during the prenatal period because it's not always standard practice to check the correctness of the situs. It's important every single time we perform an examination to carefully check the correctness of the situs. And this, let's say, we can do by checking and confirming where the head is positioned and where the cerebellum is in relation to the back, thus establishing definitively right at the beginning of the exam what is on the right and what is on the left, as you can see in the attached images where we've included this helpful diagram to help clarify what the correct orientation should be. So for example, if we look at the very first image, we can see that we have a fetus positioned head down with the spine located on the mother's left side. So everything on the right is considered at the top and everything on the left is considered at the bottom. In fact, the apex of the heart correctly points to the left ventricle is morphologically, the left atrium is morphologically left because the pulmonary veins enter there, and we also find the stomach situated below the heart, just below the left ventricle. We do the same. We have, let's say, yes, we still have a fetus in the head down position, but with the spine and cerebellum on the mother's right side. So everything that is at the top is left and everything that is at the bottom is right. And in this case as well, we need to check. The aorta is on the left ventricle is morphologically left, and the atrium above has the opening of the pulmonary veins and the stomach below, and so on and so forth. The, let's say, ease, in quotation marks, of diagnosis is related to the fact that, in reality, very often when there is situs inversus, it becomes difficult to obtain the scans that we are normally used to performing. This is because obviously the probe tends to move in a certain way that is in fact based on the usual correct organization and arrangement of the organs between right and left. Obviously, it is a rare condition because if we look at the literature, the incidence is estimated at between 1 case in every 6,500 to every 25,000 births, with a slightly higher incidence in males, 1.5 to 1 compared to females. And there is a strong genetic component. There are various modes of dominant and recessive transmission. The most common form is probably the X-linked one. In general, there are actually more than 100 different genes involved in this process, but the X-linked one, in particular, seems to be more frequently implicated in these cases. This specific gene is called ZEEK3, which is located on the short arm of the X chromosome and is, in fact, actually associated with a series of brain anomalies as well as general midline facial anomalies, which, in the case we saw earlier, were notably not present in that individual. Obviously, between the extremes of situs solitus and situs inversus, which in this case is referred to as total situs inversus, there is the broad spectrum of situs ambiguus or ambiguous situs, which is characterized by the partial abnormal positioning of certain organs, that is heterotaxy, meaning a lack of proper alignment between right and left. This is often associated with abnormal conditions, malformative anomalies of thoracic structures, usually congenital heart defects, with extremely variable degrees of association with heart defects, as well as abdominal anomalies. Obviously, in the case of situs inversus, in the absence of associated anomalies, which are very rare, the prognosis is extremely favorable. As we said, the prognosis is favorable in the absence of associated anomalies. So much so that before the advent of prenatal ultrasound, this type of diagnosis was made incidentally during examinations carried out for other reasons. Obviously, now the implementation of prenatal diagnosis has made it possible to make this type of diagnosis even at quite early stages, because while it is true that, for example, in the first trimester, the guidelines do not require an assessment of the situs, but only an evaluation of the concordance between the chest and abdomen. In reality, for an attentive operator, this type of assessment is done almost automatically. Why is it important to make the diagnosis? We have said that in the vast majority of cases, there are no associated anomalies. However, in reality, in situs inversus, there can be significant underlying genetic anomalies, such as in the case of Cartagener syndrome or primary ciliary dyskinesia. This is a rare primary condition, very heterogeneous from a genetic point of view, which is characterized by chronic involvement of the upper and lower respiratory tracts. This involvement of the respiratory tract is due to a structural and functional abnormality of the cilia, resulting in impaired mucociliary clearance. In reality, this impairment also affects other structures such as the intestines or, for example, the fallopian tubes in women. 40 to 50% of patients with Cartagener syndrome present with total situs inversus, meaning a mirror image transposition of all internal organs. On the other hand, heterotaxy in these cases is rarer, occurring in about 12% of patients, and as mentioned earlier, in situs ambiguus, in heterotaxies, also called isomerisms, there is a very frequent association with congenital heart diseases. Therefore, in this case, the prognosis is closely linked to the presence of other anomalies.